This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Okay, we're going to try this again. Take two.
The wonders of technology,
Yes,
John.
That's right. Good morning and welcome to another edition of Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll talk about the who, what, when, where, why, and how of Innovative Medical, how they can potentially help you and your family or anyone you know improve your overall quality of life. And if you have a question for Dr. Molly or you want to run a medical challenge by her, 855-839-1210 is the number here in the studio, 855-839-1210. And it's always something, Dr. Molly.
Hey, John, listen, one of my wonderful patients told me, watch out this week because a lot of electronics are going to go bad, Molly. I said, why? Oh, something's in retrograde and whatever else. So I don't follow that too well, but I'll tell you what, I've had a couple of things. I had a painting fall off my wall. I don't know, So
Yeah.
I agree. Anything can go wrong anytime on live.
That's right. But now we're here and we're back. And again, the number here in the studio, 855-839-1210. Let's see. What do we normally hear? Does this work?
Yeah, John. Does it?
How many times?
Hey, how quickly, right?
How
Didn't you?
quickly?
Listen, you had a great experience
right.
this week,
That's right.
I had a brand new patient, just came in. She wasn't even in my office maybe 3 hours. She runs into John. Well, John was sitting next to her, I guess, right?
Yes.
And she says to John, am I okay now? This is my first treatment. What could he
Yeah, I said to her, it's a process.
Right.
Just be patient. It's a process.
Well,
and this was in the middle of her first treatment.
Right. And what was, hey, listen, who is the great sports person who said, trust the process, right?
That's right.
Right?
Yes,
so
yes.
that's what we need to do too, folks. Anyway, yes, it works. However, it doesn't work instantly. It isn't holy water, and it takes a little time. But it is a wonderful way to approach any of your syndromes or anything that's impeding your quality of life. And why is it wonderful? Because we might just be able to help you reduce your need for pharmaceutical medication by bringing in the natural substances and also helping you then reduce the side effects of the pharmaceuticals as well as your condition.
Let's go back a little bit.
Sure.
What you're talking about is your system, your process of hydration therapy.
Correct.
And this can help in a variety of ways with a variety of conditions.
Correct.
So talk about that.
Well, most people come to us and, we can do anything a other primary care physician can do. My physicians are great. They can write prescriptions. They can write for radiology. We can do laboratory tests. In fact, we have one of the main laboratories right in our facility. They're right there. So, indeed, we can do anything that you would normally have gone to with your old GP, if you remember that. And actually, we're going to give you that kind of service, too, like the old-timers. Okay?
The real old-timers.
The real old-timers. But anyway, back to how we can help you. Bottom line is this. The use of hydration therapy is certainly a wonderful vehicle by which we can help correct any kinds of challenges and in bringing in the natural products that have the constituents that actually can work for your particular problem. So, for example, in our early days, and even now, John, I do a lot of cardiac issues, right? Because of the fact that there's lower slowing down of the blood flow. So we use something called chelation. So chelation can improve blood flow 12% head to toe. That's a big number when you look at body surface.
Yes, it is.
So, and then we bring in nutraceuticals that have constituents that can work on particular functions. So today we're going to talk a little bit about neurodegenerative, but there are many others, all my autoimmune people. We want to improve your quality of life. I'm not going to tell you that we're curing anything. in terms of what brings you to our facility. But I'll tell you what, we can improve your quality of life, and many times it improves so much that you're able to get off of some of the medications that you're on.
And that's one of your goals.
Absolutely, reducing them.
But you talked about cardiac, and we know over the years you've had tremendous success with that. What other conditions work best? Autoimmune. We're treating people who have MS, which is a neurodegenerative, Parkinson's. We treat people who have autoimmune, like skin disorders, lupus, scleroderma. That's the other thing. We're using a lot of nutraceuticals that have the ability to work in these particular conditions. And the idea is, John, to be able to reduce the amount of pharmaceutical a patient is on, improve their quality of life, and I think in essence help them possibly reduce the symptomatology of the condition, and allow them to live a much more functional life. We've talked about how many treatments.
The bane of my existence, right? One treatment? No.
In the middle of the first treatment, that was a very interesting conversation that we had. But how realistically, how many treatments can you expect until you see change?
I'm very happy that you always ask that question, because that's the number one question that most people ask when they come in to see me. Here's the thing. Of course, it depends on where you are in your continuum of journey within the framework of the condition. So obviously, the earlier you get in, the quicker we can resolve the issues in terms that are impeding your quality of life. But somewhere between 5 and 15 weeks, people do well. And that's the key. It depends on how quickly you get into me.
5 to 15 weeks.
That's a big spread, but not really.
But I'm thinking people will think, well, I'm cured now, so I don't have to come back.
No. Of course.
So how do you deal with that?
Look, when you're talking about chronic conditions, John, what condition? Diabetes, these autoimmune conditions, cancer supportive care, people who have certain neurodegenerative issues, you're going to be what I call a lifer. Now, that doesn't mean I've got to go steady with you every week. It means that possibly you'll come back once a month, once every other month, maybe once every. You're going to tell us when you need to come back. And that's easy, because we're going to continue to call you, be involved in your care. Listen, I do a lot of patients from out of town, right?
Yes.
There's a good example. They leave me, they spend 2 weeks with us, they leave, they go back home. But that doesn't mean I'm done with them. I'm on the phone with them. My docs are on the phone. We're sending out, if they need prescription meds, we're refilling the prescription meds. And then they come back maybe in 3 months, and they get a tune-up, I like to call. And that's how we approach all of this.
You know, it's interesting, because I'm thinking, they just think, oh, well, I'm cured now. I don't have to. So how do you deal with that? How do you
one of
make
the things
them,
I
make them
say,
see
listen,
that it's necessary to come back?
Here's the bottom line. You didn't get this condition in 5 days or 5 weeks or 15 weeks. You got this condition over a period of time. And don't think your body isn't going to get this condition or get the ravages of this condition. Now, I hope not. I've had really wonderful success stories that say, oh, I feel so good. I've never had to go back on a full dose of whatever, and I go see my cardiologist or my doctor, let's say my infectious disease doctor or my rheumatologist. I go back and he can't believe it. I'm really doing well. God bless. With the man upstairs' help, we might be able to keep you going for quite a while without having to go back. But again, the body's a machine, okay? It's God's machine. And it's made in his likeness, and he put it together pretty magnificently. But there's a lot that can go wrong.
How many times have you heard, and I know we always talk about this, Dr. Molly, the doctor said he can't do anything for me.
Yeah.
And so I come to you in sort of desperation.
Right.
What can you do for me? And how many times have you been able to be successful?
Many times, and what I say is there's only one big doctor that counts, and he's upstairs.
Right.
And I say, listen, he always gives us something else. We have so many wonderful nutraceuticals, so many natural extracts that are out there that are God-given that can help people and help the quality of life. Again, I'm going to say, look, can't cure it, but boy, do we make people feel like they're jumping through hoops, and we do, John.
Yeah, I know that.
I mean, we do.
Yeah.
Come in and see for yourself.
there has been some amazing cases
Oh, man.
that you've handled. And can you just talk maybe about one of them?
Well, I think my wonderful patient who comes down from North Jersey who has brain cancer, she's doing very well. Now, she's not a spring chicken. She's in her 80s, and guess what? She did her conventional treatment, still does, but she said, I can't tell you how much I appreciate you, Dr. Molly, because I'm able to get around, see my grandkids, see my daughter. This is what it's all about. It's about your quality of life, and I think that's an amazing case. My medical director is an amazing case. She retired from her particular specialty because she no longer could do this because she was diagnosed with MS, and she was probably in the middle of MS. I mean, it was a new diagnosis. She had it for a while, but she could see that it was impairing her ability to work as an anesthesiologist. And when she came in to see me, I said, hey, Dr. Pat, you're a physician. What? She goes, it's disheartening to have to give up my specialty. I said, and as we went through the continuum, she said, I'm starting to feel better. I feel great. I'm starting to feel good. I can read again. I can start to think again. I'm not cloudy. I said, she said, hey, how would you like me to join the medical staff? I said, I'd love you to be the medical director. That's what I would love, okay? Because you have all of the background that I need. So, and she is.
And really, I got to say that she looked terrible. But now, I mean, you see
as a patient, she looked terrible.
Terrible. Now she looks like, I mean, it's a different person.
She said, I don't want to wish this. She said, I don't think I can go back to anesthesia. Now I'm a little too old, right? Now, she said, in terms of her continuum of age. But she said, darn, Molly, I'm feeling so great, I can't tell you. And it is true. And may God bless her.
And the other patient you were talking about, I've seen her.
Yes.
And, boy, she looks so good.
Yeah.
And it's just a very... It's
John,
heartwarming.
I think you're one of those.
Yeah.
I think you're one of those guys, okay? You've come to me with series of challenges,
That's
right?
Yeah.
And for the longest time, you thought maybe you might have to give up your career, right? Because you had to speak. You had a couple of neuro problems. I said, no, you're coming back. And we did it.
Yes.
So,
and
God
that's
bless.
a testament to you and
it's
your
a
staff.
testament to the good man upstairs.
That's right.
God bless.
We are coming up on our first break of the morning. Our show is Health Watch. Every Sunday, 8 till 9 here, the live version on Talk Radio 1210, WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here in the studio. If you have a question for Dr. Molly or you have a medical challenge you want to run by her, feel free to call in 855-839-1210. We are coming back, Dr. Molly and I, with more of today's Health Watch after these words. We are back here on Health Watch, and as always, when we're on the air and even when we're off the air, operators are standing by at Innovative Medical Associates, and the number 856-489-0505, 856-489-0505. And I always say this when you call, very simple. All you have to do is book the initial consultation with Dr. Molly. You will learn a lot in that initial consultation, and you will get the information you need, whether or not you would like to move forward. But you do make the call and make the appointment. 856-489-0505 is the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. If you have a question for Dr. Molly, 855-839-1210, the number here in the studio. We're going to talk about, you have an interesting case, a patient with Parkinson's.
Right. Early onset.
Early on. What is this all about?
Well, I'll tell you, she came to me from her brother, who actually is a chiropractor. And he listens to us on Sunday. But it also is one of my patients goes to him, okay, as well. And it was like serendipitously he said, oh, maybe I should bring my mom over there, my sister over there. And I was happy to see them. But it got me to thinking, John, a little bit. I see all of these neurodegenerative diseases, and I've seen a number of them, a multitude of them over the course of 27 years. And I started thinking about this, and I said, Wouldn't it be good if people who've either got early diagnosis of neurodegenerative diseases or genetically prone for neurodegenerative diseases got in to see me earlier, right? As you know, there's more and more testing. In fact, I alluded to it last week when I said we can test now for the Alzheimer's proteins and this kind of thing. Wouldn't it be nice to come into a place like mine early on so that maybe we could reduce the chances of you getting full-blown of any of these diseases?
Yes.
And one of the ways to do this is through hydration. Because the brain is made up of about 73%. The brain and actually the cerebral spinal fluid is made up of about 73 to 75% fluid. Isn't that amazing?
Yeah.
Now, the key is, we don't want to take in too much water, right? You and I both know. There was that radio contest many years ago where these DJs told them that whoever drank the most water were going to get 2 tickets to some band or some variation of that. Do you remember that?
And somebody died.
Right, somebody died. Why? Because even water can be toxic in large quantities. And I'm using that to say, don't you think it's wise to use people who know how to really deliver the nutritional portion of this correctly, as well as how much hydration? That's why I'm so careful about people's kidney functions, because if you really deplete your sodium levels or your potassium levels, boy, we could have a major problem.
Okay, so the question I have here, and I'm thinking about this, how do you know? You're saying maybe come in earlier.
Sure.
But how do you know that you need to come in?
Well, all you got to do is watch TV today. They're hawking a million. They're hawking a million neuro drugs, a million of them,
and weight loss too.
Right, and weight loss too. But oh my God, are you? You're forgetting your keys? Are you doing? Yeah, all of those things, little subtle things. Also, interestingly enough, through COVID. And if you've had COVID, I want you to pay attention. If you had COVID or you had post-COVID symptoms, you got to look at your sense of smell, because our sense of smell gives us a little indication of what else can be happening, because the COVID virus really affected those cells. Isn't that interesting?
Yes.
That really, really control our sense of smell. The other thing is, as we age, we lose a little bit of those cells, right? And anybody who has a good Italian mother knows they're very proud of their cooking, John.
Yes,
very proud,
that's
right? Grandmom was always on it. But, we noticed as she got a little older, everything she would say just needs a little more salt, a little more salt. Finally, we had to say, hey, Grandma, not so much salt, because they just lose a little bit of that sense of smell, and that's regulated from upstairs by people. So we're very particular. We developed a brain or a cognitive well protocol, and using hydration as the vehicle.
And so this cognitive brain protocol
sure.
Deals with maybe getting the problem early.
Right, getting the problem early, maybe not definitive what your problem is. But again, of course, I'm going to run blood work. That's going to be indicative of the tau proteins, this kind of thing. The doc's going to look at you clinically and say, what's going on? Are you having a little problem? Are you starting to have a little shaking? I mean, these kinds of things. Be aware of your body, folks. That's important, right? And as we get older, things do change. I mean, it's inevitable that things change. So I think that research supports us using certain supplements, natural substances. However, again, I'm going to go back to what Dr. Molly always talks about, the Goldilocks theory. You don't want to have too much of one thing and not enough of something else, always just right. That's why I'm so worried about all of these new brain supplements that are out. You can have so much of a situation of a particular constituent that over time can be a little caustic or toxic to the brain too. So you got to be really you got to look at everything, John. It isn't one size fits all. It's not one set of nutraceuticals fits all.
And if you watch TV, there's
there's
always a commercial,
right?
Brain this and
and on top of that,
my memory's better if I use this.
And that's all great. That's all great, and I have no problem. But again, I want to really look at the constituents that make up these products, and I can tell you, John, that's where you need advice. It isn't just come in, sit in my chair, and quick, you're done. And we give you advice as well as to which nutraceuticals maybe might work better for you. And I'm not dishing, or as they say, is it dissing? Is it dissing? Now, I'm not dissing all of these supplements because there are some out there that are excellent. But like everything else, if you go into the health food store, you're just going to get what the clerk thinks is right.
That's
right?
And that's not always guaranteed.
Right. Sometimes they have too little of the stuff in it. Sometimes they have too much.
That's
so
right.
The bottom line is Goldilocks.
We are at the halfway point of the show. It is Health Watch every Sunday, 8 till 9 here, the live version on Talk Radio 1210 WPHD. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio, and it's a good time for you to call because we have some open lines. A good time to call, 855-839-1210. We are coming back. More of today's edition of Health Watch right after these words. We are back here on Health Watch, and as always, operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. If you'd like to call, I suggest you call right now because they're standing by, 856-489-0505. That's the number. And you want to check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And I should point out that on the website, you can hear some of our past shows, and there's a little summary of what the show is about. So if you wanted to check us out further, you can do that. innovativemedicalassociates.com is the website. The show is Health Watch every Sunday live here on Talk Radio 1210 WPHT. We're here from 8 till 9. And we are got some open lines, 855-839-1210. That's the number here in the studio. We were talking, Dr. Molly, about brain prevention.
Right.
What are some of the nutraceuticals that you use?
That's right. That's a good question, John. And again, I'm going to start with a very important vitamin, which you and I both know is vitamin D. So I think conventional wisdom out there, every new mother, everybody knows, listen, early brain development is very, very important. Vitamin D is very important, right? And the deficiency, though, this is interesting, has been linked to conditions like dementia, depression, autism, and schizophrenia. In fact, there's been numerous studies, and if you go on PubMed, and I did this morning, you can look at how many countless studies about the need for vitamin D and brain health. And here's the thing, and this goes back to my philosophy of Goldilocks. It's important to have enough vitamin D. We like to see the vitamin D levels in our patients, up there and maybe in the, I guess, between 500 and maybe even 1,000, which is a little bit over the daily dose requirement or whatever. But I've got to tell you, if you use too much D over the long term, that can also affect and have some adverse effects. So it's always good to just have enough. And that's something we're very, very, I think, proactive for our patients. As you know, we'll recommend brands that work without giving you too much. Because guess what? It affects your calcium levels. And this has been an interesting thing, because so many people have linked vitamin C and kidney stones. And I just read my good friend Dr. Tamara Carr's book, and she indeed goes back to vitamin D as one of the culprits for kidney stones, because it can block blood vessels, get kidney stones. So you want to make sure you get your D vitamin checked all the time. It's not just good for your bones, it's also good for your head. So that's one of them. And we use vitamin D very interestingly because we put it in certain oils. We don't just give you the traditional shot.
How about that? I
know. You get a D shot, though. Okay, so that's one of the things we use. We also use, of course, things like choline. And choline's normally found in eggs, and it's an essential nutrient that helps the brain make NAC, which is a neurotransmitter, which is something we use as well. And you noticed in the past I talked to you about using neuroamino acids. Well, indeed we do, and these are two of them. And we use that in a way to help maintain brain health too, not just to correct certain challenges that a patient has, but to help prevent some more of these challenges. So again, choline is one. Another one we use is phosphatidylcholine. And you've heard me talk about phosphatidylcholine and phosphatidylcholine, and that's what we use. So this is a naturally found it's found in the brain tissue. This is important stuff, and it plays a critical role in activating the release of chemical messengers to the brain for signaling pathways that actually help the neurotransmitters. So these are some of the things that we use. And there are more. Vitamin C, your favorite, we use. And in addition to that, I want to talk a little bit about magnesium today. Because magnesium is getting a lot of play right now in the regular press. And, we talk about it, right, for all kinds of issues. But here's the thing. Magnesium is widely available right now. Look at your TV. There's a million magnesium products, right? And it's generally in green leafy vegetables, and that's where we get our extracts from. But you want to make sure you don't get too much magnesium, because it's great for the brain and it helps people with preventing dementia, hopefully slowing it down. It's not a cure for dementia, but they've done research and showed that people who have dementia and certain other issues tend to have lower magnesium levels. But if you get too much magnesium, what do you think happens? And everybody knows this because when they were kids, their mother picked up milk of magnesium, right? Except we didn't call it that. It causes gastric issues like nausea and diarrhea. And even high toxicity causes some problems.
The tendency for people, and they're listening to you now, and maybe they're writing down a few of these ingredients or nutraceuticals.
Sure.
Don't go into the health food store and buy everything that Dr. Molly says without getting some advice.
Right. And that is always my key, because, again, you hear me say it all the time. What do I want you to do? Goldilocks. Not too much, not too little. Very, very important. Another thing we use, which is extremely important, and I love it, an antioxidant that we extract from grapeseed. Grapes, red wine, help protect cells from damage. Now listen, that is not an invitation for all of us Italians to go out and drink 2 bottles of Chianti, okay? But it's certainly something that it can help the deterioration of the hippocampus, an important part of the brain that's associated with memories. So, there was a lot of research about this in the anti-aging and longevity specialists, and in all of the longevity products you will see resveratrol in their products. And again, you want to look at this and see that we have to be careful. Why? Because if we have patients who come in who have a problem with blood clotting, right? So we have to watch that they're not getting too much of that particular constituent that can also cause a problem. And we also have to watch people who are on blood thinners. So again, a simple thing, we think, oh, it's natural, it's great, go do it, let's take buku of it, right? And in the end, you got some problems. So, again, we want to watch how much of something we give someone.
You were talking earlier about brain wellness and coming in early and just really dealing with just getting well without a medical challenge or anything.
Right.
How do you do that?
Well, one of the things I found interesting in this past few weeks, because of all the heat-related issues we've had,
yes.
You know how many children are bringing their elderly moms and dads in to be hydrated?
Probably a lot.
A lot. So we know that hydration alone, and how can I hydrate their wonderful parents without throwing in some really good nutraceuticals too,
That's
right?
That's right.
I'm not just going to add 1,000 liters of fluid. And it's interesting because several of these folks have said, we know we could go into urgent care, but they really only give her the fluid. And
yes,
I said, yeah, I know. And they said, we thought this might be a better way, and they're listeners. So, indeed, it is. Because then we can do things like with what? B vitamins, right? And B vitamins definitely play essential roles in brain health.
you're not going to get that in urgent care, right?
Usually not.
No.
Usually not.
Just the fluid.
Right, you're going to get the fluid because that's the order. The order is for the fluid. In our place, the order is going to be for the fluid and the vitamins.
That's the key
And I think
ingredient.
that's the key. So, for example, B complex is crucial for supporting brain function, protect against memory loss, cognitive decline, and certain neurodegenerative diseases. But there are other things, right? We need to look at B6, B9, which is folate. And you will hear me say it over and over again. We look at folate as opposed to folic acid for many of our patients because they cannot utilize the folic acid. They have a methylation genetic problem that will not allow them to get all the good benefits of the B9. So what we want to do is we want to mimic what God has given us, and that's the most important thing. So B12, again, we're going to use a methyl B12 if you have a problem with methylation. So they're necessary for the metabolism of homocysteine. And I run the homocysteine levels. That's another interesting. This is all important in the methadone metabolism, and we have to really look at this. High blood levels of homocysteine levels causes oxidative stress and DNA damage. And it's not just cardiac. Everybody thinks, the reason why they run the homocysteine is for the cardiac issues. It is that too, but we're really looking at neurodegenerative issues too.
So if I get this straight, how many treatments would you have when you're just coming in for hydration?
You might get five treatments, 10 treatments,
okay.
And then sometimes people like it so much they come back.
Yeah.
And that's okay because if you're getting the stamina you need to get through the day. I would tell you, particularly the last few weeks during that terrible heat wave.
That was awful.
Everybody was suffering. So that was something. And what we got to look at is, and the good news is once you came in, we ran blood work. So we don't put anybody in the chair that we're not going to run blood work on, and we can actually see whether they're dehydrated or not.
We are coming up on our final break of the morning. The show is Health Watch every Sunday, the live version here on Talk Radio 1210 WPHD from 8 until 9. 855-839-1210 is the number here in the studio. We still have time to take your calls, so if you have a medical challenge or you want to ask Dr. Molly a question, feel free. This is the time to do it, 855-839-1210. The show is Health Watch with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And I'm your host, John DeMasi. We are both coming back. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch. Again, operators standing by, and they will be there well after we leave you at 9 o'clock. And in fact, they'll be there all day. 856-489-0505. That's the number. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you miss any of today's show or if you just want to hear it again, our Health Watch replay this afternoon, 4 until 5 here on Talk Radio 1210.
I'm laughing, John, because
WPHT.
they should cut out the first 2 minutes, though, right?
Yeah, well, whatever, yeah. 855-839-1210. That's our number here in the studio. Let's go to the phones. Frank in the Northeast. Good morning, Frank. Welcome.
My favorite fellow. How are you, Frank?
Hi, Dr. Molly. Hey, John, long time no talk, John. How about that?
Yeah. How about that?
I talked to him less than 21 hours ago.
You're a wonderful guy, Frank.
Dr. Molly, this morning when your show first began, I started going to instant withdrawal. Okay, I have a convulsion.
Oh, well, thanks, Frank. You should have been on this side of the mic.
That's right. It was a little more panic here.
I'm all... Well, my end, I'm like a bear. I store up. I stock up on Dr. Molly's doubles now to repeat because in the football season there's no repeat. It's hard.
That's right.
Dr. Molly, the question I have for you: Friday night, nothing on TV, nothing on radio. I was asking Alexa different questions about me.
Okay.
I asked her before, but she's goofy. She doesn't give you an answer, and all of a sudden she gives you a ton of information. I asked her about all my problems. My neuropathy, my retinitis pigmentosa, maldigestion, malabsorption. Here she was saying caused by leaky gut. And also she was saying about dysfunction in the gut microbiome.
Right. The microbiome is the big, let me say this, Frank, the microbiome is the biggest buzzword around. But you know what that is, right? It's just the makeup of all of the bacteria, the good bacteria. Right? Yeah. It's been, listen, we just didn't have a fancy name for it back in the day. Go ahead.
And also, she said something I don't even think about. I've had enlarged lymph nodes in my neck, underarms, and everything.
Yeah. Yes.
Going back maybe 30 years or so. She was saying that could be caused by one of those two also. Is that true? And also, I'm sorry, go ahead.
Sure. Let me tell you something. I'm very, as you know, in my office, I'm very attuned to a lymphatic drain. I have some nutraceuticals as well as I have homeopathics that we deliver because we're very, very involved with the lymphatic, keeping that lymphatic flowing, because what happens is sometimes all the bad junk gets stuck in the lymphatic tract. And if you notice it with cancer patients, many times the lymph nodes have the cancer in the lymph nodes, which is bad because that system is a closed system and you've got to keep it running, Frank, definitely. And I do know people who have a myriad of autoimmune, which I believe you do, tend to have the lymphs blocked, and so therefore they show as swollen. Let me say this, Frank. I have a product, and I will see to it that you get it. It's drops that will help with that, I think. And I will definitely see to it that you get it, all right? But I also use it IV.
For leaky gut, Dr. Alexa, right before Dr. Molly, she says eat glutamine, probiotics, and omega-3s.
Good.
Is that
and
right?
Prebiotics, maybe she was talking about. Let me say this. It's interesting you bring that up because, believe it or not, it has a lot to do with brain health, too. Because of what? The gut-brain axis. Leaky gut can affect people's brain function. So I agree with you. I think, I also believe that lots of stuff starts and stops in the gut. And you really need good gut health is important for optimal cognitive function too, according just in reference to what we were talking about. So I appreciate the question. Yes.
Dr. Molly, you mentioned about magnesium and dementia.
Yes.
I remember back at community college in one of my science classes, this is back in the 80s, about Alzheimer's. At that time, they found high levels of aluminum. Is that still true?
Well, I think metals can cause it, but also we're finding more and more of these tau proteins, right? So, yeah, I agree with you that heavy metals have to be tested. And if I recollect, in part of your packet that you were kind enough to send me, you were tested for heavy metals, right? As I recollect, weren't you? Yeah.
Probably, I forget. They tested a million different things. I forget.
Yeah, right. Heavy metals, definitely. You're right, Frank. So that's true. So that's something I would definitely look at. But probiotics and prebiotics are important, also not just for gut health, but for brain health, which fits right into what we were talking about today. Thank you, Frank,
Thanks, Dr.
for these
Molly.
calls.
And
Frank.
hi to Mayor Joe.
Thank you.
Okay.
Thank you.
Thanks for the call, Frank. 855-839-1210. Again, we have a couple minutes left of the show, so we have time for a quick call. 855-839-1210. Wrapping up what we were talking about before the break.
So again, I was talking about the B vitamins, and again, this is another, Goldilocks theory. You've got to watch because certain conditions like B6 can actually cause people, if you have too much of it, can cause some nerve damage. It can lead to nerve damage. So again, what you want to do is you want to take advice. You don't want to just grab everything off the shelf. And we use B6 in our IVs, obviously, but in a certain ratio. And finally, I want to wrap this up with something I think people will really like. Okay, theobromine. Theobromine. This is a natural stimulant found in dark chocolate that helps people feel more alert without jittery. In other words, without the caffeine we get in our first morning coffee. So one of the articles I read said you ought to start telling your docs having your docs talk to your patients about brewing a very cup of dark chocolate as a source of this particular constituent before they go to work. I think my patients would love that.
Yeah, I tell you. You wanted to talk about a patient, and using repurposed medications.
Oh, yes, yes.
For
yes.
Parkinson's.
Yes.
What is that about?
Yes. Well, it's about using low-dose medications and repurposed medications, not just for Parkinson's, but for many conditions, including cancer patients. And this is the thing that separates us from a spa. We are able to look at the patient, see the blood work, look at these things, and say, "Oh, guess what? We can use naltrexone, for example, in a low dose, in a way that will help a patient through some of these kinds of conditions, Parkinson's, for example." So why wouldn't we repurpose naltrexone that's usually used for reversing opioids in a way that would help a patient with Parkinson's? That was one of the things. We can use many others. For example, we've used some of the diabetic medications for patients who have cancer because we want to hold the blood sugars down. But again, using it in appropriate amounts, maybe smaller amounts, repurposing the meds that can do a job that is sort of, they used to call it, possibly off-label. They would tell the doctors it's off-label. It's been approved for one function, but you can use it for others, assuming that the physician is knowledgeable enough to do that, and most of them are.
Guess what? We're out of time.
Okay. Thank you, John.
That's going to put the wraps on another edition of Health Watch. Don't forget, if you would like to make that initial consultation with Dr. Molly, it is complimentary. 856-489-0505. Operators standing by right now. They'll be there well after we leave you. In fact, they'll be there all day. 856-489-0505. That's the number for Innovative Medical Associates. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. That's the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, Jim, and Daniel. And then there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, 8 till 9. Health Watch, Talk Radio 1210, WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.